If you wondered how we numb teeth as pediatric dentists to make it more comfortable for your child, then stay tuned to this video. I'm going to give away a few of my secrets. Hey, if you're new to me and new to this video, I am Dr. Jasmine Elmore, a board-certified pediatric dentist, breathing, myofunctional, and airway expert. I don't do rushed appointments and I don't cut corners. People want to know how I see what other dentists miss, and so I created this YouTube video for parents to check out inside of my mind, because several of you asked, so you can get an inside look as to how we make sure that your child's dental care is not just good enough, but we make sure that it's precise, personalized, and built for a lifetime of health. Yes, parents strive to see me and my team because here, every detail matters. And that's why they call me Dr. Elmore, AKA Dr. Detail. Every concern is heard, every tooth is examined, and every treatment plan has a solution that is custom to each child and one that lasts. So I don't follow the rules most offices live by, I rewrite them. If you're done settling for, let's call it basic or routine dental care, and you want true, meticulous, science-based pediatric dentistry that we call optimal care here at Optimal Kids, then you're in the right place. Guys, I'm so excited for this video. I love giving local anesthesia to children. It is so important that your child is numb for dental work. People ask me all the time, what's the #1 behavior management technique of pediatric dentistry? There are a few. Having a calm patient helps, all the little tips and tricks and all those things matter. But the #1 thing is making sure the child is properly anesthetized or numb. Working and drilling, using all these little tools on kids that are not numb is a big, big, big mistake. We have lasers now, all kinds of modern technology that apparently are anesthetic free, but most dentists will tell you that as a cavity gets deeper, or if it's a moderate sized cavity, you're still going to need to supplement that laser with some anesthetic. And so I've had so many kids tell their parents that the numbing that I gave them was so much different than any numbing they've ever had. And there's a couple reasons why. We're going to share some of those secrets in this video. If you're here from my Instagram, then you've already seen that we've talked a little bit about, I went on live and talked about the techniques, most of them. I left off one. We're going to talk a little bit about a few. The tools, the techniques, the temperature of the local anesthetic, and also the secret, I think, that has made the biggest change in my career, which is buffering the anesthetic. So we're going to talk about all that right now. So the first thing is the tool. You guys have seen these. People ask me all the time, why is it colored? Because these are cushions for those thumbs and fingers. If you're a dentist or a mechanic or a physical therapist or anyone who works with the manual dexterity of your fingers, you know those joints are important. And so it's just a little cushion. That's all that is. But this is a dental aspirating syringe. And most dentists, guys, most of your family dentists, your general dentists, they are going to be using what we call the yellow needle, or a 27 gauge needle. And the gauge is the thickness. So I'm going to show you a 30 gauge needle in a second, which is what we use. But the 27 gauge, I don't know if maybe it'll pick up on my black jacket here, but it's a thicker gauge than the 30 gauge. Even though the number is lower, the lower the number, the thicker the gauge. And so some dentists even use 25 gauge needles, which is crazy to me as a pediatric dentist, of course. It seems barbaric. But, you know, each dentist has to use which tools work best for the situation they're using them in. But here is, and it's shorter for a variety of reasons. But hopefully, I don't know if it picks up on camera, but hopefully you guys can appreciate, maybe I'll do it this way, can appreciate the thinness of the 27 gauge being thicker and the 30 gauge being thinner. It's definitely thinner in thickness. And we're talking about millimeters, guys. But the difference definitely matters when it's being put into your mouth, or as people try to tell me, when they're jamming it into your jaw. And so that thinness definitely matters when we're going to inject by tooth. So the first thing is the tool. And so, to my knowledge, it's not something you can request. So I don't think you can ask the dentist, hey, can you use a different gauge needle? They've got to use what's in their comfort zone. But for us, pediatric dentists, the majority of us are using, especially for young patients, we're using the 30 gauge needle versus the 27 gauge needle. All right, so that's the first thing, is the gauge. I want to make sure I safely secure these as we move to the next thing. So the second is the technique. Okay, so many people don't know this. I found that out when I talked about this on Instagram, that many of you did not know. There's something called the gate control theory, which says that if we apply a non-painful stimulus in the area of a painful stimulus, that the brain will essentially, to simplify this, only be able to focus on one thing at a time, and it will essentially distract the brain from noticing the painful stimulus that is occurring. So a lot of times you'll see your dentist moving the cheek or the lip, kind of giving it a little shake, and that's the gate control theory. They have different devices that actually provide that stimulation in the areas, do the exact same thing. Most experienced pediatric dentists are not going to need the fancy tools. We're actually going to be able to provide that stimulation by hand. Tools are cool too, though, so if they use the tools, that's great. I will say with tool and technique, one of the other things that goes well with this is time. As you have a full carpule, I'll just take it from our next section that we'll talk about in a second. But if we have a carpule, which is what these are called, of local anesthesia, then once the needle is placed on, we're going to be able to push and inject this local anesthesia in the liquid. This little button will push down and the fluid will go into the area that we are placing it. How quickly we push the fluid into your body is also going to determine how much of the liquid going into your body that you feel. So the more time that a dentist has to take their time with injecting, you're going to feel that comfort as well. So the tool, of course, matters. The tool matters. The technique with something like the gate control theory or taking time to inject slowly will also make a big, big, big difference. The great thing about our office is that we see one family at a time, and we're a boutique practice. So because of that, we have more of a focus on the patient. More of my time goes into the patient care, less of my assistant's time with the patients, and those things matter. I'm gonna put this back. I'm gonna bring you guys over with me in a second for the next step, which is temperature. Not that many people talk about the fact that the body is one temperature. For most of us, it's about 37 degrees Celsius. And so a lot of times if we pull a carpule out of our drawer, I'll show you my little anesthetic drawer here that the staff keep for me. Move my notes and everything out of the way so you guys can see. There we go. So I have a little anesthetic drawer down here. And so if we were to just pull anesthetic out of the drawer, right, it's room temperature. But what if we could mimic body temperature, okay? And we're able to do that if we use something called an anesthetic warmer. This is a composite and anesthetic warmer. We're not talking about composites in this video. We will in a very soon future video. But for the anesthetic, we can heat it up to whatever temperature we'd like. I like 37 degrees Celsius because it's right there with the body's temperature. And so you're just giving it a little, if you take it out of the little container, a little body temperature. It's very subtle. But the temperature, having the injection of something in a similar temperature in the body also matters. It's something that I don't do for every patient, but I definitely use for my most nervous and fearful patients. Any little tip and trick or secret that I can use helps a ton. And so giving appropriate temperature anesthetic matters. So we've talked about the tool. We've talked about the technique. We've talked about the temperature. One thing we missed when we talk about technique is topical. This is a commonly debated topic, is topical, because a very small population of people have an allergy to benzocaine. Our younger kids, let's say we're working on infants, we don't know if their body has the right biochemistry and markers. I'm not going to get into all the details, but benzocaine can be a concern. So a lot of times we have to have the pharmacy make a special topical. So if you go to someone who's doing lip releases and tongue tie releases on your infant, they're not going to be using a topical that we would use here in the office. But for those people who love topical, you either kind of have the camp of we love topical or the camp that we don't like topical. For those who love topical, I always tell parents that one hidden thing in this topical is dyes. And so this is a dye-free topical. Hopefully that focuses, but this is a dye-free pina colada topical. They have many brands, and we choose here dye-free because a lot of our patients, the parents, have concern of dyes. We have parents who prefer no dye foods, and so we add this to the list of things that we have for them that is dye-free. Tool, technique, temperature. And the fourth thing that I find to be probably the most important is the acidity. Most people don't realize that we mainly use lidocaine, but the articaine, lidocaine, septicaine, this whole family of local anesthetics have a much lower pH to the body than the body. Body is a nice mix of 7.35 to 7.45. Mouth breathers and over breathers beware. We're going to be more acidic than that. But the body has to lie in a very finite acidity, or else it's donezo for us. We don't survive in a super acidic state for a long period of time. And no, your alkaline water doesn't impact your alkalinity. That's a whole nother video. But as a nutritionist, I can tell you there are some things we're marketed to that are not maybe from a scientific perspective as proven as we think. But for the purposes of this video, we're talking about local anesthetics and local anesthesia. The acidity of those anesthetics is usually around 4, sometimes 5 pH. And our bodies, again, are at 7. And so we're injecting this low pH solution into our bodies. A lot of times you'd be surprised. It's not the needle you necessarily feel. It's the acidity change of the fluid entering your body. And so there's something very special we can do to resolve that. This video isn't sponsored. Well, I wish it was, if we could get these products for a cheaper price. Maybe if you guys write them and say, Dr. Elmore told us about your company. We told our dentist. Now our dentist has the product. Maybe they consider giving me a discount. But this video is not sponsored. The product's just that good. It's called the Onset Mixing Pen. Okay. It's by a company called On Pharma. Again, this is not sponsored. They have many companies for buffering. This was a company I researched. I spent a lot of time investigating, if you can't tell, into the things that I use and what I want to put my brand behind. And so On Pharma met my very harsh criticism of companies to work with. And it comes with a whole, how-to guide for doctors and all that. So as we're training new assistants, they know what to do. Of course, me being who I am, I buffer all the lidocaine myself. The assistants don't, but they get the kid ready and we all work together as a team. But I do the final work. That way, if I break the multi-$100 thing, it's on me, not on them. They appreciate that. But this buffering system is with 8.4% sodium bicarbonate. And what it does is it injects the sodium bicarbonate into the carpule. So let's just take a carpule of articaine. What did I do? Oh, here it is. Take our carpule of articaine. And it goes, it's a very simple process. It goes into this back end here. There is a sterile sharp inside of here that is penetrating the carpule, and we twist it down. There are numbers here on the carp. They make it easy. We go from 0 to number 9, and number 9 is in green. I mean, they really make it easy to use. And when I push this button up here, there's a little gap here. When I push this down, it's going to put the smallest amount of sodium bicarbonate into this carpule. So we just push the button down, and now there's sodium bicarbonate in this carpule. So I've got I like to place it within about 30 seconds or less before I'm going to load up my syringe and inject the anesthetic into the body. So we like to do it right at the last second. But now this carpule is loaded and ready to go. And now the pH of this is now 7 to match the body's pH. How cool is that? So buffering the local anesthetic will make it more comfortable when the anesthetic inserts into the body. Comfort is so important when it comes to pediatric dentistry and children. It's one of the most important things that we do. The other thing is that when the local anesthetic is buffered, the effect is fast, much, much faster when it's not buffered. Also, it helps provide a more profound anesthesia for my kiddos and teenagers who say they have a hard time getting numb. Parents will say, I shouldn't say all the time, but weekly, parents will come in and say, hey, I have a very hard time getting numb. I suspect my child does as well. We give the buffered anesthetic, and within minutes, sometimes within less than a minute, the child is like, holy cow, I'm numb. And the parents are floored. That's science. Science makes us able to do that. The flip side of that is that the anesthesia is more profound. It kicks in faster. It also wears off faster, which is a big deal when it comes to children and preventing them from biting their lips, cheeks, and tongues after procedures. So I think that the buffering is probably the number one thing that we provide here that makes our numbing experience more comfortable. I have some patients who would disagree with that because buffering is a new add-on into my new practice here at Optimal Kids. I've numbed people for over a decade before this, and almost all of them say that my anesthesia technique is more comfortable than other docs. So buffering plays a role, but I think the doctor's entire attitude behind if they drip out a little anesthetic before, how fast they push the anesthetic into your body. Do they take advantage of the temperature aspects? Do they take advantage of the gate theory of control, the gate control theory to make it more comfortable, using a non-painful stimulus to distract the mind, and what thickness of needle they use. All these things matter. So there's so much more nuance to it, but I think this is a good summary for those of you curious about local anesthesia and possibly what your office may be doing to make things more comfortable. Again, I've shared what we do here at Optimal Kids, and if you're interested, we'd love to have your child here in the office. So I hope this video was helpful. If there's anything that you didn't find out in this video, leave me a comment down below and I will answer your question. And if you have any ideas for future videos, leave those down below as well, and I will get the video that you want made for you. So again, I hope you enjoyed this video. I'm Dr. Elmore, aka Dr. Detail. Until next time, I'll see you guys in the next video.